here we are today on Doctors in the House. Today I have one of my best friends who is also a dentist, general dentist here in the Silver Spring area with me. Is Dr. William Kelson, one of my main men.
Everybody.
And I am Dr. William A. Taylor. Today we're filling in for Dr. Darrell Hill, and we're going to discuss various things in dentistry that you people should, take a little heed to and kind of take our advice on. So we'll start with my man, Dr. William Kelson. Question to you, man. When patients come in our office, diagnostically, they're like, why do we have to take these x-rays? Why do you have to do this? Why this? Tell me in your opinion and help me here. Explain to everyone why we do things in a systematic manner, such as the exam, then we take the x-rays and things of that nature.
Well, thanks everybody for tuning in. Again, I'm Dr. William Kelson. I have a practice in Silver Spring, Maryland. I've been practicing there over 20 years. It's a comprehensive dental practice. We do all forms of dentistry, everything from basic cleanings to root canals, extractions. We're even doing implants now, so it's a good thing to be in dentistry right now. The question that you ask, we get that from a lot of patients. They just want to come in, they just want to get their teeth clean, they don't want to take x-rays. But just like anything else, we try our best. We are doctors. We have a doctor. You have a DMD, right? What do you have?
I have a DDS.
A DDS. I have. That means Doctor of Dental Surgery. Mm-hmm. So we basically, in dental school, we learn the same way that physicians do. We learn everything about the body, the nerve, the blood vessels, veins, and everything such as that. And we also learn the way that these things are affected by the oral cavity. Mm-hmm. So we are doctors. So we do a diagnosis. When a patient comes in, we take x-rays. We chart them. We take their blood pressure. We do an oral medicine screen. We look at everything because we want to be comprehensive. We don't want to just be someone who just cleans teeth. So doing a full diagnostic workup, x-rays, charting of the teeth, charting of cavities, what we call periodontal probing of the teeth, lets us know exactly the status that person is in. Doing that comprehensive workup also can actually help them or prevent them from having other medical problems. You can actually diagnose diabetes, heart disease, lung problems just from doing a thorough diagnosis or workup of that patient. So when a patient's at, well, why do I have to say? Because there are certain things we can't see. There are a lot of things we can't see. It will be impossible for me to do a service to a patient without taking the proper x-rays. I can only see the outside of the tooth. Mm-hmm. I can't see the inside of the tooth. I can't see below the gum line. So therefore, having that x-ray lets me see everything that's going on inside the tooth as well as below the gum lines so I can make a proper diagnosis.
Okay.
That was a long answer to a short question.
No problem, no problem. Also, both of us in both our practices, we use what we call digital x-rays now, which is probably the highest quality of a diagnostic aid that you're going to get close to. A lot of doctors are also buying the big expensive cone beams,
right.
But we haven't arrived there yet. But that's another means in three-dimensional. Three-dimensional diagnostic aids, mm-hmm. in which we do take those cone beams when Dr. Kelson and I do implants, because what it does is it keeps us out of trouble of placing an implant, let's say, on a nerve or rupturing a blood vessel or some artery, and also, it placing it in the correct place.
Position, going through the bone.
Yeah, going through the bone.
That wouldn't be
so, and that wouldn't be a good thing. Yeah. So today we're going to discuss also when a patient comes in, and let's say the patient's, you do your probing,
okay,
and the patient's bleeding.
Okay.
let's talk about the number of millimeters of a when we perio probe, of what is acceptable to what is moderate to severe, what we call periodontal disease.
Well, first of all, when a patient comes in, and that's part of the whole myth thing that we'll talk about later, and bleeding. When you just mentioned bleeding. Okay, so when a patient comes in and they say my gums bleed, okay, that's part of a myth. Most people think that bleeding gums are that's okay. It's natural. Everybody's gums bleed a little bit, but I will ask a patient, well, if your arm was bleeding, would you think that's normal for your arm to just bleed like that? And most of them would say, well, no, my arm shouldn't be bleeding. Something has to be wrong to cause your gums to bleed, okay? And so bleeding gums is the earliest sign of what we call periodontal gum disease. And that should let you know something is wrong. So for those out there who brush their teeth and they wake up in the morning with blood on their pillow, or when they rinse out and they spit and they're spitting out blood, they should know that there's something wrong. Usually the causative agent for that is plaque tartar and the bacteria that's associated with that. Okay, so brushing, flossing reduces the amount of bleeding. Okay, so anyway, once again, bleeding gums is not normal. Okay, so we will do a probe, and a probe basically is an instrument that goes below the gum and will calibrate how far there's what we call detachment of your gum is from the surrounding structure, the bone or the tooth. And that probe has got millimeter markings on it. And those markings let you know if it's 2 or 3 millimeters outside of normal, or 5 or 10 millimeters outside of normal. And so those instruments are used strategically around each tooth to gather, again, more information. Part of the whole diagnostic process is what we're talking about. And we'll get, again, more deeper into that with the bleeding and things such as that later.
Okay. Now, we're gonna talk about myths in dentistry. Right. Very fun. He and I talk about every day about some facet, in dentistry, and the myth facet has come up. A myth. I don't have to go to the dentist until my tooth hurts.
Okay, well, truthfully, you really never have to go to the dentist. I mean, you don't have to do anything in this world, okay? But that's just like me saying I never have to go to the doctor until my chest starts to hurt, or I'm feeling a little wheezy, or I can't stand up, okay? Going to the dentist should be as regular as going to your physician, as regularly going to church, something like that. Because what happens is that, once again, we talked about, we do a comprehensive workup of a patient, we can prevent certain systemic problems just by examining your teeth. So if there is when we get to the pain threshold, when we get to the area where you're actually having pain, then it's already too late. Once again, it's like, okay, I'm having a heart attack. Now it's time for me to go to my doctor. Wrong time, okay? I'm having problems getting up the stairs. Now I should go to my doctor. Wrong time. The right time to go to a dentist is at least once a year, most likely once every 6 months, so that the doctor can do a proper exam to find out if you are a candidate, just like we always use the word candidate in medicine now, a candidate for diabetes, if you're a candidate for gum disease, okay? And are you a candidate for caries? There are people that are cavities prone, hereditary-wise, okay? There are more people that are periodontally prone, hereditary-wise, okay? So if you have a history in your family, and the only way you know that is by going to the dentist and having a proper exam, medical history check, and saying, did your mother, did your grandfather, did they lose their teeth early? Some people just have weak teeth, okay? Enamel dysplasia, okay, where the teeth or the enamel does not form properly. But how do you know that if you don't go to a dentist?
Correct. Yeah? Another myth. I don't have to brush my teeth every day.
Well, I mean, there's a lot of jokes that come out of that one. Okay, brush only the teeth that you want to keep. You know, that's one of the jokes that come out of that. But teeth brushing again is just part of your everyday hygiene. You have to and you should brush your teeth not only every day, but you should brush your teeth after every meal. Okay, because small films form on your teeth, and the stickiness of that film that's left behind is additive. Every time you eat, that more stickiness, more buildup gets on your teeth. So if you eat 4 times a day, 4 or 5 times a day, and if you're only brushing once a day, well, you're missing, 3 or 4 times a day with your oral hygiene. So that's a big myth that you don't have to brush your teeth every day. Yeah, okay.
Another myth.
I'm going to ask you something.
Okay. Last myth for you. Should I brush my tongue? Why? What's the importance of brushing my tongue?
Wow, that's a good one. Okay, should I brush my tongue? Well, we're sitting kind of close. Okay, and your tongue carries odor. Okay, and the reason why you brush your tongue is for several reasons. The real scientific reason is that there are minor salivary glands on your tongue called papillae. And these papillae are on various positions of the front, the middle, and the back of your tongue. And these papillae, believe it or not, help you to taste food. So if, for instance, you go somewhere sometimes, say the food don't taste as good, they don't taste like it used to. Well, you may want to check your tongue, because these papillae, if they're occluded or if they're dirty or if they're covered over, then these papillae are not working the way that they should to gather the correct information from the food, something sweet, something bitter, something spicy, something that just has a great taste to it. You might be missing that because these papillae have been covered by the plaque, again, the tartar, the film, the bacteria, and the information is not getting there. Also, these papillae will grow. So the bacteria acts on these papillae as a nutrient, okay? And the bacteria just sits there, and also that bacteria is giving off waste. Now, it smells. So that's where a lot of people get bad breath from, is because their tongue is dirty. So every now and then you should stick your tongue out and just brush it, okay? Every day. That's part of your oral hygiene, okay? So it's very important to brush your tongue, okay? I mean, we're sitting a little close, so, I just want to make sure.
Yeah. Ask me a myth.
Okay. One of the myths is, okay, well, I don't have to brush my teeth because my teeth are going to fall out when I get older anyway. So your teeth just fall out when you get old. That's a myth. Is it a myth? I don't know. Is it a myth?
That is definitely a myth. So I guess I'm going to place this on the older generations, who basically put that out there.
Okay.
When you get older, your teeth are going to do nothing but fall out. Well, that did happen back in, I guess, the early days.
Okay.
Only because no one went to the dentist.
Right.
They would not brush, they would not floss. It was, not institutionalized in the home setting. So what happened? Bacteria created, let's say cavities or the holes, as our patients come in and say. Then after a while, that tooth becomes, brittle.
Or loose. Yeah, back then they called it pyorrhea.
Pyorrhea of the gums.
They didn't call it periodontal disease. They called it pyorrhea of the gums. They really didn't know what it was.
Right.
Because scientifically, we didn't know what it was.
Right.
Until the term periodontitis came along, and periodontists found out, there are bacteria that's actually eating away at the bone, and that causing that tooth to get loose. Okay, right. And so now we termed it periodontal gum disease. So as the old folk call it, you got pyorrhea of the gum.
You got pyorrhea of the gum.
So,
and I think too, in our community, the African American community, diabetes runs rampant.
Wow. Yeah.
I have seen patients that were normal, teeth were fine, and then at one appointment they would come in and there's looseness. And I think a lot of this when the older individuals years ago, before they even started really being aware of type 2 diabetes, teeth would get loose, and their myths arise from that because teeth will get loose.
Right.
You'll lose the structure around the gum line, and the next thing you have what we call mobility of +3, which is a very mobile tooth, in which that tooth could fall out, or and it can happen in just a short period of time.
Right. Well, there's a direct correlation between periodontal gum disease and diabetes, and vice versa. Okay, both have to be controlled. Okay, so if you're diabetic, you must adhere to strict oral hygiene regimen, okay? Or you will not control your diabetes, again, and vice versa. So that's so important, okay? And so that myth about you just get old and your teeth fall out, that's just a myth. I don't plan on losing my teeth when I get on. And I tell patients when they come in, well, you're not going to just lose your teeth from old age. Again, there is a correlation between heredity and maybe mom or dad, but if you take really good care of your teeth, okay, if you control your diet, and you will not lose your teeth just because you turn 70 or 80 years old. Okay, so those we gotta get rid of some of these myths that we just don't understand. That kind of plague our community and let us think that because Okay.
Well, and one of the biggest myths that we laugh at all the time, patient comes in and says, I have a hole in my tooth, but it doesn't hurt. Why do I need a root canal? I think, can't you just put something in there? Can't you just fill this tooth?
Well, okay. So this is, a lot of these are myths, and these are things that we see every day. I'll go to the dentist when it hurts, okay? Or I have a hole in it, but it doesn't hurt. So therefore, why do you, they're not talking to me, they're talking to you. Why do you have to bother it? The word is bother. Why do you have to put a filling in it if it doesn't hurt? Once it starts to hurt, once again, that's the wrong time to treat it.
Wrong time because inflammation,
right?
Swelling,
exactly.
Pus and exudate, intraoral, extraoral swelling,
right? All of that,
all of the above, and you get that call about 3 o'clock in the morning.
Well, you get that call because I go to sleep. I'm just joking. I don't go to sleep. I wake up.
He wakes up.
Yeah.
He wakes up. But, all this can be preventive. Again, going back to when you come in to our office, we take the diagnostic radiographs.
Can we back up just a little bit?
Sure.
Okay, because what you just said about the tooth has a hole, it's not hurting. Why do you have to have a root canal? Okay, so initially, if you have a hole in your tooth, it doesn't hurt. Okay, because you have the enamel layer that's probably in it, probably maybe into the second layer, which is the dentin layer of the tooth. Okay, but once it gets to the nerve layer, okay, it will start hurting. Okay, and some of you may have experienced that. The tooth was hurting, and then all of a sudden there's pixie dust or something, and the tooth doesn't hurt no more. Wow. Okay, I'm good. You're not good. Okay. That just means that the nerve has completely died off. Okay, the bacteria is settled in because there is a live nerve and there's what we call a dead nerve. A live nerve is, say for instance, I cut my skin, okay, and I could probably go in there and find a nerve vessel in there. But what happens in a tooth is that once bacteria gets in there, it just eats away at the nerve, and the nerve turns to what I like to tell patients, it turns into mush. Peanut butter, that's what it looks like once the nerve is dead. It looks just like peanut butter or any other dead material. So now it doesn't hurt anymore, okay? But you're not out of the woods, okay? That tooth could sit like that for 10 years, okay, and never ever have a problem. 20 years. Or it could be like that for 3 months, okay? But that bacteria is just swimming around in there and waiting for the opportunity to cause swelling, okay? Or pain because it's got to go deeper, and there's a lower lying nerve that'll get to, or an upper lying nerve that'll get to it, and then it'll start firing off, and then you're like, oh my God, you know. Then they call you at 3 o'clock in the morning.
Yeah, exactly.
And so what happens is that the root canal, again, I don't know, we don't do pipe cleaning anymore. I mean, when I was in school, we had to clean these little pipes, you know, when we're in scientific lab. But a root canal is sort of like a mini brush, and it goes down into the tooth, and it kind of pipes clean that tooth out until it's till all the bacteria flush out. Again, we're talking peanut butter or baked potato or something like that. So it cleans it out, okay? And then there's a synthetic material that goes down and closes or closes off that hole now, so that no more bacteria can get it. Now the tooth is okay. And if you do have a tooth, just want to say, if you do have a tooth that has hurt and it hurt for a while and then all of a sudden stop hurting, and you need to be careful. You need to get to your dentist because that tooth is harboring bacteria, and it can also cause death, okay? Because the bacteria will travel to the brain or to the heart, and it can cause death. I hate to say that, but there's been many documented cases of death associated with a infected tooth, and so it's something that we do not take lightly. Okay, it's not something that you should take lightly as a patient. Okay, as a consumer.
We're going to go to a commercial break, and then we're going to come back, and let's start with when we come back talking about a little of that bacteria. Let's say on a tooth in the upper arch, as you just stated, how serious that can be going to the maxillary sinus.
Sure. Okay.
Station break.
2018, I personally helped several people reclaim their healthy lives with a ketogenic lifestyle. Together with our team at Wakaya Perfection, we have helped over 4,000 people struggling with weight loss, burn off unwanted fat naturally, control hypertension, type 2 diabetes, and high cholesterol with our Beulah Fit Keto Fuel Shake and high-impact ginger and turmeric. Contact me for yours. Buttons about that ketolife.mywakaya.com. That's BUTTONSBOUTTATE.MYWAKAYA.com or call 202-875-3926.
This is a keto-friendly diet, and weight loss expectation is approximately 1 to 2 pounds per week. Individual results can and will vary.
Business owners looking for a place to advertise your business and promote your products and services? VoxWave is the right place. We have over 10,000 views a day and 70,000 listeners a month. For more information, contact Reg Gaskins at 240-832-4455.
VoxWave now features a streaming radio media player on our website's front page, where local artists can get their music played 24/7. For more information on getting your music in rotation or to perform live at our studio, contact Reg Gaskins at 240-832-4455.
Android users, the VoxWave app is now available in the Google Play Store. Download the app today on your Android device to listen in and view programs.
And we're back to Doctors in the House. So what we were just discussing before we took a break was how infection can travel from an upper tooth into your sinus. The sinus cavity is a very complicated concavity in which a lot of times we have roots that are actually in the sinus. And that's why most of us will refer those teeth, if they're to be extracted, to the oral surgeon, because you can actually pull that sinus bottom out as you're extracting a tooth, or sometimes fracture, the plate back there. But mainly if there is decay that has extended into the nerve tissue on an upper tooth, it has to go somewhere. So that infection is going to go straight up, and at the bottom of the root, it's going to come right out of there and into the sinus cavity, and then we have a major problem.
Major problem. Yeah. Once again, going back to that tooth that has decay in it and that has not been treated, or the tooth that previously had pain and the decay has caused the pain no longer. Cause the tooth no longer to be in pain, we have to deal with that tooth one way or another, either by extracting that tooth, taking it out, okay, root canal in that tooth, okay. Those are the two forms of treatment once the nerve has been violated by bacteria. The sinus cavity drains, all the fluids in the body, okay. So if the fluid is, if all the fluids in the body are being drained through the sinus cavity, and the tooth has an active bacteria, well, that active bacteria, once again, is traveling throughout your body, going into your heart, your lungs. Even there's something called aspiration pneumonia, where that bacteria goes into your lungs and causes infection. So there's so many ways in which bacteria from your teeth can enter to your body system. That's why it is so important to deal with that decayed tooth. Or with that periodontal disease, and not just leave it as my teeth are getting loose, or my gums just bleed, grandma gums bleed, or my dad gums bleed. It's not that simple anymore, because now we know so much more about how those fluids travel, how the bacteria travels and things. So, in fact, if it does get into the sinus and it does cause a brain abscess or something such as that, you will expire from that. So it's a complicated system, but it's a very simple system, in fact, in how things happen in the body.
So hopefully you're getting some good information out there today. And we're going to move on to some more pleasant things in dentistry. We're going to start talking about some cosmetic dental work, such as crowns, veneers, implants. Great things. We love it.
There's a lot going on in dentistry right now, man. It's just, dentistry is exploding with all types of stuff. But the other thing is that it seems though that our dental education is going down as opposed to medical. People are educating themselves medically, but in terms of dental wise, they're not so educated in terms of that. So we want to bring some of these things to the forefront. Okay. So I'll ask you a question, and you'll answer, and you can ask me what. Okay. I'll ask you basically, what is a crown? And because you hear that term a lot, what is a crown, and why do you do a crown on the tooth?
Okay. So to the general public, when the general public comes in,
right.
I need that thing called a cap.
Okay. All right. Yeah.
Well, a cap, in lay terms, is a crown.
Okay.
The reason that we do crowns on teeth are when there is about, am I correct, 1/3 of the natural tooth structure fractures dictates most of the time us doing a crown. Now, the question that we normally get is, why are you cutting more off of my tooth? Why are you cutting this tooth down? Well, we call it preparation, or prepping the tooth. You have to cut that tooth down or prepare that tooth in a certain manner such that the crown can actually fit over what tooth structure is left and fit, let's say, in this distinct part of your mouth and look just like your normal tooth.
Okay, right. So, and you're so right, because in doing a crown, there are so many other reasons to make a crown, okay? We call it restoring, and we call it a crown because it is the outside portion of the tooth. It's the portion of the tooth that you see, okay? And a crown restores or puts back, okay? We talk about restorations all the time. Back what was missing, replaces, okay? And most of the time, crowns are placed on back teeth. There are a lot of people with crowns on their front teeth, and we'll get into that, and bridges and things such as that. But a crown replaces what was missing. You may have had a filling that had been in your mouth for, let's say, 10 years, okay? And let's say that filling is cracked now, or there's some separation between that filling and the tooth now. Well, a dentist like myself is not going to dig out the old filling just by itself. I'm going to dig the filling out. I'm going to place more filling in there, but I'm also going to put something over that tooth to protect it from the force that caused the tooth to break in the first place. Okay, and that's very important. So a crown is a very good restoration to have. Also, if you have a root canal is the inside portion of the tooth. We just talked about hollowing out the tooth and cleaning it out and then putting a synthetic filling in there. But what I'd like to explain to patients that once you have a root canal, that tooth is more like a eggshell that there's no more yolk inside anymore. So if you put pressure on an eggshell, it's just going to crumble up and break. Okay, so now with doing a crown on that tooth that you've saved the tooth with a root canal, you put what we call an anchor in there, like what we call a post. I'm using some layman terms, but we anchor that tooth with a post, and now we restore it with the crown so that once again that eggshell or that tooth just doesn't crumble when you bite on it. It's got strength now. And crowns are made from all types of materials now that are just strong. I mean, we have zirconia, we have porcelain, we have all metal, we have gold. But most of the crowns now are made from a substance called zirconia. You might have heard the term cubic zirconia. And that zirconia is so hard. Okay, it's as hard as your tooth structure. And in some people's terms, even harder. And that will allow you to bite on that tooth, hopefully the rest of your life, without having that tooth crumble again. So crowns are extremely important in dentistry. People don't understand that in order to put a crown on, yes, certain parts of the tooth has to be taken away. But again, we're restoring, okay? So just like when you're doing a house restoration, you don't just put something new over something old. You take the old part out and then you place something new on top of it. You know, so you can't just put a new tooth on top of an old tooth.
Correct.
You're restoring it. So crowns are extremely important. And so if you have any questions about crowns, you can of course call Dr. Telly. He'll tell you all about that and things such as that. But I love doing crowns. I do a ton of crowns.
We love it.
I love it. Okay.
Because they're so cosmetic also.
Yeah.
Which is what we're going to discuss next. Anterior crowns. Now, the question that you probably get, that I get all the time is, hey, I want to look like Denzel. I want my teeth just like Denzel.
Hey. Hollywood smile.
The Hollywood smile. Yeah, that's the other thing we get. I want the Hollywood smile. So let's discuss and tell everyone about veneers, which is probably in Hollywood. Would you say probably everybody in Hollywood? I would say about 98% of everybody that you see on TV. We notice it when we look at people. But you want to be very particular, as we'll discuss, because there are cases in which, you know, everybody wants the veneers. They want them all white, but that is not sometimes the best thing to happen, because it will look like you have chiclets in your mouth, you know?
Well, I'm glad you asked that question, because I do quite a few veneers, and the veneer is the most cosmetic procedure that you can do in terms of getting your teeth to look good. Let's go back just a little bit. Let's just step back a little bit, okay? Let's talk about whitening and things such as that, and as opposed to crown and veneers and things such as that, because just cleaning your teeth, first of all, will make your teeth look better. Okay,
correct.
Doing the correct thing. But then once you get beyond that, people go, well, I have these teeth that are out of line. I have these chips on my teeth. My teeth are a little darker than my mother's teeth. Okay, and again, remember, everyone's teeth are not the same color. Okay, my teeth are dark. They've always been dark. Your mother may have taken tetracycline when you were in the womb. Okay, so your teeth are dark from that. Everyone wants whiter, prettier teeth. And so when we're talking about veneers are porcelain restorations. It's almost like look at your fingernail if you can. And that fingernail size restoration goes on the front of the teeth. And we usually put veneers only on the always, only on the anterior teeth. Well, sometimes I put a veneer on a premolar, a first premolar, but it doesn't, veneers don't go on back teeth. And so what these veneers do is that a technician will shape and color that fingernail size restoration to look exactly the way you would want your teeth to look. I mean, it'll make it nice and round or oval as with women, and more square as a man. But we can color those veneers just like fingernails. They color those veneers on a shade gradient scale of what we like a Vita shade, and they'll make those veneers white or just semi-white or just off-white. Okay, and when I do veneers, I tell patients that there's a difference in color of white. If you look at white paint, no one's teeth are just white. Okay, they're different hue of white. Okay, eggshell white is just different from sheet white. Okay, so and having just white teeth don't make it all perfect either. Your complexion, I mean, me and you are the same complexion. Yeah. So your complexion also determines what color that veneer is. Okay, so backing up, the veneer is just a fingernail size projection that goes on the front of the teeth and it goes over the edge. You do have to remove tooth structure when you're placing a veneer, but they're beautiful when they're done well. They enhance your smile 100%. Okay, they're long lasting. They don't discolor if you drink coffee or tea, things such as that. That doesn't discolor them. You do have to maintain excellent hygiene, but porcelain laminate veneers are the most aesthetic restorations that you can get right now. Okay.
Now, you hit a good point. The color that you choose for that patient, you always get it in the after effect. Well, what if I want to brighten my teeth a little more?
Right.
Well, that is not going to work, because the color that the technician places in there is the only color that is going to be achieved with that veneer, unless you want to pay for a new set and get them lighter.
Right.
So most of the time what we'll do is we'll have a patient bleach their teeth.
Okay. Yeah. That's
upper and lower arch, and see how far we can get them. And then from that point, a lot of times we'll do the veneers, afterwards. We'll do it, various ways.
Right.
And then let's talk about teeth that are malaligned, that we can use the veneers. Sometimes people's teeth are lingually located, which is most of the time, or smaller. And you can achieve a more perfect smile, let's call it, with placing a veneer in there, would you say?
Well, you can. And again, you just mentioned bleaching, okay? And bleaching sometimes is achieved prior to doing a veneer, okay? And we can talk about bleaching also. If you have normal teeth that have good enamel, well, doing a bleaching is also a good cosmetic option, okay? You just either use some of the over-counter, and I would start with over-counter products, okay? White strips, and using some of the whitening toothpaste, okay? Bleaching usually does not work on heavy tobacco stains, okay? Tetracycline stained teeth, so you want to find out what that is. You can go on the internet and look up what is tetracycline staining and see if you may have that. Bleaching does not work on enamel dysplasia, where there's a defect in the enamel which shows more of the dentin portion of the tooth. So there's certain things that bleaching will not work on, or whitening. It's the active ingredient is called carbamide peroxide or hydrogen peroxide in its purest form. So you can use a whitening agent first. That's what I would try. And then if that doesn't give you the results, then you're looking at doing cosmetic veneering or crowning of the teeth to do more than one thing. Correct the alignment of the teeth in small alignment problems. You can close some gaps with crowns and veneers, okay? And also you can correct some slight overbite, overjets with the with veneering, okay, with the crowning. So cosmetics is I love cosmetics because you get that immediate effect of showing someone going from bad teeth to good teeth. I mean, I do that every day. We do full mouth restorations where we go from molar to molar to correct the smile. I've done it hundreds of times over, and the same effect is always there. Wow. Okay.
And isn't it a great effect when you have a patient that is very satisfied, and then you see them in public and they're grinning ear to ear, you know, and would you agree also, people feel better.
They feel amazing.
You know, a lot better when your teeth are looking good.
When they're looking good.
You know,
I don't know if we're able to get any. Probably won't be able to get any video or audio on. I would show some pictures of before and afters, but maybe we'll do that the next time. Okay. But anyway, the effect on a person. I always say this: there are certain hidden personalities in people. If someone doesn't smile a lot, it's usually not because that person may be a mean person or having problems. They may not just have the smile that represents the real them.
Correct.
Okay, or the person that's hidden inside of them. Okay, there may be. I mean, I've seen this time and time again where there's a whole different individual hidden behind a bad smile. Okay. And until we bring that out of them with doing veneers or crown, they just continue to be in that state of, okay, that person's mean. Well, you don't know until, you know, and I've seen that over and over and over again. Okay, so shyness, you know, can also be, well, the opposite of can be brought out if their teeth were looking good. Just, again, sadness, because some people just feel sad. They've never had a good smile. So doing cosmetic veneering with whitening, the movement of teeth with, we're going to talk about that, tooth braces or Invisalign, is a life-changing experience. It is not just. It's not just about the teeth.
Correct.
It is not about this. It's way beyond. It goes so far beyond that you'll never understand. You know, it's just. I love it. I love it. Me and my staff, we never get tired. We see a case come in. It's like, whoa, okay, let's get busy here.
Yes.
You know, it's just to bring this person to their full, potential right now. Okay, and we do it. I wouldn't say quickly. We do it efficiently, and it doesn't take too long. It takes a lot less time than most people think. Yeah.
We're going to go to a station break, and we're going to come back and discuss Invisalign and traditional braces, is how those fit in our practices, and we'll touch on implants. See you in a minute. All right, we're back. We're going to discuss with you traditional braces versus Invisalign. Okay. And you and I both do Invisalign in both of our practices. And we've seen patients being taken, from very crowded teeth, let's call them, to, as straight as we can get them in the arch. What do you think? Let's discuss traditional, when a patient may need traditional braces versus Invisalign, because everybody wants to walk around not with the wires, as they call them.
With the wires, yeah. Well, I mean, that's a great question too, because I mean, once again, there's an explosion of Invisalign technology. We have Smile Direct, I think it's called, where you're doing it at home yourself now instead of going to the dentist. Okay. Everyone, if you can do it, in your car, you could just take a mold. So let's talk about those things. Invisalign and the Invisalign story is that Invisalign wasn't even created by a dentist, which is crazy. I wish I had Invisalign. But Invisalign is a way to move teeth using what we call aligners. They're plastic apparatus that go on the teeth, and they have certain movements within that plastic to help move a tooth from, say, here to here, or to align the teeth. Okay, so it's called Invisalign because it's aligning teeth practically invisibly, with the clear plastic. That's the theme behind Invisalign. When it comes to traditional braces, okay, I do Invisalign, but I do keep a stack of referral in my office for traditional orthodontics, because every case is not an Invisalign case. And again, and this is just a message to those at home who are doing it at home, you may be doing yourself a disservice or just spending money if you're not properly diagnosed as needing traditional as opposed to Invisalign, as opposed to a Smile Direct type thing. There are what we call dental abnormalities or dental defects of the teeth, and there are skeletal defects which will cause the teeth to not be aligned. Okay, and so when we deal with the dental misaligned teeth, you may have what we call just traditional crowding or spacing. Okay, but when you're talking about skeletal problems, you may have a jaw that protrudes further out. Okay, or you may have an extra large jaw, or you may have a closed palate, which means you have what we call a narrow palate. There's so many skeletal abnormalities that would lend you to have traditional braces as opposed to Invisalign. Okay, so I think that we, as ones that do Invisalign, we do a great service. Okay. But we also have to be careful as not to overstep our bounds, okay, when we're doing Invisalign, to tell a patient, well, you're going to be able to correct this problem with a clear, transparent apparatus, because the wires have certain forces that the orthodontist can put on to cause your bone to move or expand, because that's basically what's happening. Is the bone is moving and the teeth are shifting. Okay, so you can't just do all of that with a plastic piece. You can't do all of it with a plastic piece. You need something more traditional. So for those of you who are considering doing Invisalign, please visit a dentist that can do a proper diagnosis and let you know which one's better for you, because they both work.
Correct.
But you need to choose the right one for you.
Correct. And a lot of times too, we see teeth that have not erupted.
Not erupted, unerupted,
super erupted
teeth on top of teeth.
Yes. So those teeth a lot of times need forces.
Right. My cousin called me the other day and said, my daughter has 36 teeth. It's like, aren't you? I mean, it's like 36 teeth. I'm like, I'm sure some of them are in the bone somewhere.
Yeah,
they're not all.
They're just not all 36
teeth in the mouth. Right. We have what we call supernumerary
teeth.
Right, or where in cases where you don't have the correct number of teeth that you're supposed to have. Missing laterals is very, very prominent. Your lateral teeth don't come in, they're not there. You're looking on the x-ray going, the mother's looking at you, the father's looking at you going, where's my children's teeth?
Right.
My child's teeth. And we're going, well, they didn't develop. Okay? And there's nothing you did or that they did that could have caused that. So orthodontics has to be looked at very specifically, especially when we're talking about clear aligner technology and things such as that. Do not be fooled that it can all be done just so simply, because in the day and age we want things simple and easy, immediate, quickly. And so visit a dentist that will give you a true assessment of what's going on with your teeth.
Which brings me to the next point and our last point, implants.
Okay, once again, yeah.
As we were just talking about missing teeth, missing laterals, this era now, more people are getting more fixed prosthesis, which is an implant instead of partials, let's say, and fixed dentures.
Oh man,
we love doing this.
Yeah,
stuff.
that's a whole discussion in itself.
Yeah,
implants and the explosion of implants onto the dental market and also onto the consumer has been tremendous. And when you're discussing implants, it's just, once again, the internet is a great source of information, but it's not the best source of information when it comes to implant, because most people don't realize that an implant is not just a single prosthesis that you can put your teeth on. Most people don't realize an implant is nothing more than a screw. But how many of these screws do you need?
Correct.
To replace your teeth? Where should they be placed? Are you healthy enough for those screws? Do you have enough bone for this discussion? This is a 3-hour, honestly, a 3-hour
no
discussion,
question.
because we're still learning about implants. We're still learning their value. And so when we talk about implants, the basic thing is that an implant is not a tooth. It's something you can build a tooth onto. Okay, it's a little screw that goes into the bone, and that bone has to be harvested, or that bone has to grow around that little screw, make that screw strong. I tell people, think about you putting a deck up in your backyard. Okay,
right.
First thing you do is you dig a trench. Okay, and then you put some cement in that trench. Okay, then you put the post in that trench, and they leave that post in that cement, and say nobody touch this post, for the next 48 hours. Okay, because if you touch that post before that time in the wet cement, it never ever gets it's hard enough to hold it down. So an implant works pretty much the same way. We make a hole, we put an implant in the bone, and then we leave that implant undisturbed. Okay, so I'm saying a single implant, but once again, diagnosis and treatment planning is so important, because how many you need, where they place, the location, the cost, all that has to be discussed with your dentist. So the implant is placed, and now we can put a denture, a crown, on top of that, what we call ankylose or integrated implant. It's very important. So what do we talk about here? It's crazy.
We could go on all day
about talking about implants.
These are things that you and I love
that
to
come
do.
into the office. They want implants. I want that.
I want that implant.
I want that implant. But again, they may or may not be a candidate. Again, because does periodontal
goes back to periodontal disease,
osteoporosis. Okay.
Yes.
All those things affect whether you can even have an implant or not.
Right.
Okay.
Let's touch on cost and we'll touch on medications. A lot of times patients' medications won't allow them, let's say patients on a blood thinner.
Yeah.
You really don't, you kind of want to stay away from certain, let's call it, things in dentistry, such as implants, when you are a bleeder.
Yeah, well, bleeder, patients that smoke a lot, and things such as
smoking.
That will cause your implant not to integrate. And so it's important to get, again, a good diagnosis, because implants are what's the first thing that people ask about. We want to know about these implants. And implants is a wonderful modality for someone to use to restore their dentition. Everyone's not losing their teeth for gum disease. Some people lose their teeth because of an accident. They may have been in an altercation, knocked a tooth out or several teeth out, or they just may have had poor oral hygiene when they were children, never could afford it. Mom and dad could never send them to the dentist. Every time they went to the dentist, they pulled the tooth out. So now they're in a position to say, hey, I want to have what I never had before, okay? Can you give me some implants? And again, implants is not something you do, and they do, okay, let's not say that. They do place implants in many instances in a day and restore.
But it's a case by case.
It is a case by case
selection. You and I would prefer we do it, I think, the more traditional method in which we let it heal for 3 months.
3 to 4 months.
3 to 4 months.
Implant has to sit.
Right.
Get strong.
To us, that's the way we do.
And that's the way most oral surgeons
do.
And then let's get to that real quick. I know we'll probably run out of time, but implants are being done by everyone. General dentists, periodontists, even endodontists, root canal specialists. You should know that there are different skill levels, for placing implants. So don't, just go by someone that says they place implants. Again, I keep a stack of referrals in my office because I only place the simplest forms of implants. Some implants have to be done by an oral surgeon, a periodontist, who, again, will do a different treatment because of what we see on the x-ray, on the cone beam, whether there's bone that needs to be harvested into the site. There's so many aspects to implants. So it's not as simple as most people think it is. It's not that simple. It's very, very complicated, and every case is a case by case. Don't be fooled by the commercials. Every case is a case by case by case selection. You're not just going to walk in and walk out with teeth the same day. Without you being the perfect candidate for that type of treatment.
Well, this ends our discussion for today with my main man, Dr. William Kelson. I'm Dr. William Taylor. We're both general dentists in the Silver Spring, Maryland area. I hope you enjoyed today's talk and hope you learned a lot.
Yeah.
Take care.
Take care. Bye-bye.